Welcome to the summary presentation. As a safe, effective, and productive trainer, you must become competent at implementing the training camp program with a variety of clients. When implementing it, be aware of all gym safety guidelines and operational procedures. Whether you're working with a single client or a small group, it's your responsibility to be a positive and motivational leader, which will maximize the effectiveness of the program. Welcome to the summary presentation. When working with fitness enthusiasts and athletes, you need to understand nutrition strategies and know how to teach these topics. The combination of diet and exercise helps clients reach their training potential and body composition goals. By using academic resources and professional recommendations, you can educate and empower clients to make healthy dietary changes to maximize performance and achieve ideal body composition. Welcome to the summary presentation for the Integrated Training Components and Exercise Technique module. The training camp program is structured into 8 distinct sections. These sections include the pre-workout stretch, cardio warm-up, dynamic warm-up, quickness training, performance prep instruction, performance prep, ultimate performance instruction, and ultimate performance. It's important to understand the scientific rationale for each section to maximize results and minimize injury risk. Welcome to the summary presentation. A specific marketing and advertising plan that starts with your ability to promote your expertise is important to business development. By focusing on building your knowledge of exercise science and MMA conditioning, learning how to address the needs of clients, and establishing positive relationships within your community, you'll have a thriving business while providing a valuable service. But there are tremendous responsibilities that come with this profession. By recognizing scope of practice and legal considerations, you should be well protected and able to communicate with your clients as well as maintain proper expectations. Welcome to the Introduction and Objectives presentation for the Nutrition and Supplementation module. An individually planned nutrition strategy can improve health, reduce the risk of disease, increase energy levels, and enhance sports performance traits. It also creates a leaner body composition. This module provides concepts and solutions that can maximize results of the training camp program when a client wants to achieve weight loss, muscle gain, and performance enhancement. After studying this module, you'll know how to provide clients with basic nutritional recommendations for optimizing health, performance, and weight control. Also, you'll have the information to suggest pre-exercise and post-exercise nutrition and supplementation strategies for optimal performance. Lastly, this module teaches you proper hydration recommendations and how to identify signs of dehydration in your clients. Welcome to the Introduction and Objectives presentation for the Coaching and Program Implementation module. As a trainer, you must implement and deliver integrated fitness programs, such as the training camp program, to a variety of clients in multiple settings. The training camp program is designed to accommodate these diversities, but you must prepare yourself to provide a proper environment so each client can succeed with minimal risk for injury. This module explores gym safety, program operations, communication, motivation, and coaching techniques to safely and effectively implement a training camp program. After studying this module, you'll know how to observe the best practices and facility policies to minimize the risk of injury. Also, you'll be able to successfully and safely implement a training camp program in a variety of settings, including traditional one-on-one and small group training. Lastly, you'll learn to effectively communicate, coach, and motivate clients during an MMA training session. Welcome to the Introduction and Objectives presentation for the Business Development module. MMA strength and conditioning has vastly expanded over the past 5 to 10 years. As a fitness professional, you now have a unique opportunity to offer your services in a new marketplace. Though this marketplace is growing, sound business practices and solid marketing plans will enhance your opportunity to reach this demographic. After studying this module, you'll recognize important business development opportunities to ensure a successful career as an MMA conditioning specialist. You'll become aware of marketing and other strategies to build a large clientele base, and you'll also have an understanding of legal and ethical issues surrounding the health and fitness profession. Welcome to the module on integrated training components and exercise technique. The training camp program teaches you how to effectively deliver MMA-inspired conditioning programs. It employs an easy-to-use, scientifically valid, and clinically proven training system. This module outlines a scientific rationale for the training camp program and how to apply techniques in a safe and systematic fashion to increase the benefit of each exercise while minimizing risk of injury. At the end of this module, you'll understand the scientific rationale for exercises, know how to describe and apply techniques in a safe and systematic fashion while enhancing results and reducing the risk of injury. Welcome to the summary presentation for the Injury Prevention and Movement Preparation Programs module. In working with today's typical clients or MMA athletes, you must take special consideration when designing MMA conditioning programs. To aid in injury prevention and recovery from intense MMA-inspired workouts, you should include movement prep programs designed to address musculoskeletal dysfunction and correct faulty movement patterns. Movement prep programs include 4 phases: inhibit, lengthen, activate, and integrate. To maximize your client's success, be proficient in teaching these programs. Welcome to the Integrated MMA Training presentation. This presentation discusses how to select appropriate exercises, as well as design programs that are safe, effective, and sport-specific. Choosing components for a program requires careful selection of activities that meet specific criteria. First, all MMA conditioning programs need to be safe. They should also be challenging, progressive, systematic, proprioceptively enriched, and sport-specific. Here are the key concepts for proper exercise progression: slow to fast, simple to complex, known to unknown, low to high force, static to dynamic, and correct execution of increased repetitions, sets, and intensity. As you remember, the training camp program helps you develop the best possible levels of functional strength, neuromuscular efficiency, and cardiovascular fitness through the proper use of integrated training variables. You can also tailor the program for clients by modifying planes of motion, body position, base of support, lower and upper extremity symmetry, external resistance, and balance. During training, you need to emphasize to your client the concept of quality before quantity. Also, you need to be aware of the sensory information that's stimulating your client's central nervous system. If your client trains with poor technique and poor neuromuscular control, she will develop poor motor patterns and stabilization. So, you'll need to ensure that her program focuses on the functional continuum. The factors in the functional continuum serve as the backbone of the training camp program. They use exercises that are multiplanar, emphasizing all three planes of motion, use the entire muscle contraction spectrum as well as the entire contraction velocity spectrum, and manipulate all acute training variables, such as sets, repetitions, intensity, rest intervals, frequency, and duration. Welcome to the Integrated Program Design for MMA Training presentation. When designing MMA training programs, you need to develop the right blend of training knowledge, experience, and skills. If you don't, you may design inappropriate or ineffective training programs. The best way to achieve consistent and superior results is to follow a structured, systematic, and progressive training program. At the end of this module, you'll be able to describe the training camp program, and you'll understand the individual components of it. You'll also understand how to cater to clients with limited time or physical capabilities. Welcome to the module on Injury Prevention and Movement Preparation Programs. The training camp program employs high-intensity, circuit-based strength training techniques to help clients achieve remarkable levels of physical fitness. To minimize the risk of common musculoskeletal injuries associated with high-intensity training, clients should incorporate movement prep programs to maximize recovery and regeneration. This presentation reviews common injuries that happen in athletic activities and the rationale for movement prep programs in aiding injury prevention. At the end of this module, you'll know how to rationalize the need for movement prep programs, also known as corrective exercise. You'll understand all of the elements of the corrective exercise continuum, which is outlined in the table you see here. You'll also know how to decrease the risk of injury by incorporating corrective exercises into your client's program. Welcome to the Human Performance Testing and Evaluation presentation. To develop an individualized MMA conditioning program, you need to have an understanding of your client's goals, needs, and abilities. This means understanding what they want to gain from the program, what's needed to help them reach their goals, and their capability to accomplish tasks in an MMA setting. To gather this information, have your client perform human performance testing. The rest of this presentation focuses on the specific health and sports performance tests specific for MMA athletes and enthusiasts. Human performance testing is a systematic approach to problem solving that provides you with information to make educated decisions about acute variables for your client. A systematic schedule of assessments provides you with ongoing information to allow you to monitor and adjust your client's exercise programs. As they improve their physiological and functional capacities, you can help them realize the full benefits of an MMA conditioning program. Remember, human performance testing is not designed to diagnose any disease or condition, so any client who exhibits pain or difficulty moving should consult a physician. A fitness assessment provides you with a three-dimensional representation of your client. It uncovers information about your client's cardiovascular fitness, strength, power, movement ability, and medical history. With this information, you can create an individualized MMA-inspired conditioning program. When performing these assessments, use a variety of observation methods to get a balanced overview of your client, with both subjective and objective information. Welcome to the Communication and Coaching Techniques presentation. Effective communication is often the difference between success and failure in your relationship with your client. Effective communication skills are a learned behavior, and regardless of the mode of communication, it's important to start building a positive relationship with new clients through proper communication skills. Here are some tips for enhancing communication with your clients. Communicate consistently according to your personality and training style. Use a positive communication approach that includes encouragement, support, and positive reinforcement. Ask questions. The only way to know if a client is satisfied with a conditioning program and their progress is to ask questions. Finally, speak clearly and concisely when providing exercise instruction. Knowing how to motivate and inspire clients to succeed comes from knowing what they want to achieve and why. The following are key points to keep in mind when determining how to best motivate your clients participating in the training camp program. First, inspire, don't command. Be empathetic, not sympathetic. Don't allow clients to settle for second best. Always push them to their best. And lastly, reassess and jointly review data. This allows your clients to see objective numbers, displaying their progress. Encourage clients to self-monitor by recording their progress toward each of their goals. This holds clients accountable and motivates them through this challenging process. Self-monitoring is usually done in a daily written record, such as an exercise and nutrition log. Self-monitoring helps a client see their progress, which builds self-confidence. Logging a workout serves as a reward for your clients, and self-monitoring also helps clients identify challenging situations and barriers to exercise. Remember, you set the tone for each workout, so the success of your clients begins and ends with you. But coaching them isn't an easy task. So, to effectively coach, keep 3 things in mind. First, focus on the clients the entire time. Second, understand proper exercise technique. And last, and most importantly, know how to correct improper exercise technique. It's important in a group setting to maintain discipline, especially while clients are working at levels of high intensity. At times, your clients may become discouraged, fatigued, and even want to give up. You must recognize your client's physical and psychological stress and allow for leniency, while maintaining your professional presence. As an effective coach, always prepare and be ready to take charge of the group. And be consistent, and speak loudly and clearly. Welcome to the presentation on exercise technique and safety. In all sections of the training camp program, proper exercise technique and safety are very important. Clients must understand certain precautions, such as proper posture and breathing patterns. This maximizes the effectiveness of the program and can reduce the risk of injury. Proper posture helps ensure proper exercise technique and decreases unwanted stress on the spine and joints. Some common posture mistakes clients need to avoid include turning the feet outward, caving the knees inward, arching the lower back, and rounding shoulders and head forward. These mistakes during exercise can cause joint pain and injury. You can ensure proper technique is demonstrated for each exercise when you review the following 5 kinetic chain checkpoints. The checkpoints are the feet. They should point straight ahead. The knees. Check for alignment between hips and toes. Next, look at your client's hips and low back, making sure they demonstrate a neutral pelvis. Then, shoulders. Look to see that they are depressed and slightly retracted. And finally, look at your client's head and cervical spine, making sure they're in a neutral position. It's important to create a safe environment that maximizes performance potential. Clients have different strengths, weaknesses, and cardio fitness, so you need to properly select safe yet challenging exercises. An example of progression would be body weight squats to squat jumps like you see here. Remember, understanding exercise progressions and regressions is important. Maintaining proper breathing patterns during exercise is extremely important to help avoid undue fatigue and spikes in blood pressure, especially for clients with chronic diseases such as hypertension or other forms of heart disease. Correct breathing ensures the body is receiving adequate amounts of oxygen for working muscles. Proper breathing includes exhaling during concentric movement and inhaling during eccentric movement. Avoid the Valsalva maneuver because it can raise blood pressure and cause headaches, dizziness, or fainting. Welcome to the Gym Safety presentation. The training camp program is dynamic, intense, and often involves multiple people and equipment. So you and your clients must adhere to all the best practices, rules, and facility policies. This helps to minimize the risk of injury or weight room-related accidents. Also, it keeps the environment safe, clean, and professional for all to enjoy. To ensure the training camp program is facilitated in the safest way possible, you need to follow a checklist. First, all training camp programs must take place during business hours of operation. No one is allowed to participate in the program without qualified supervision. Prior to participation, all clients must undergo a thorough fitness assessment process. You should require a provider-signed medical release from clients with chronic disease, or moderate to severe musculoskeletal limitations, such as low back pain, prior to their participation. Other safety measures include advising clients not to use unfamiliar equipment without proper instruction. They should also follow gym etiquette at all times and not engage in horseplay. Also, you and your clients must wear proper workout attire. When demonstrating proper use of all gym equipment, tell your clients not to throw dumbbells or barbells, and they need to return all equipment to the correct rack when they're done. Remember, it's up to you to ensure that equipment is in proper working condition. Here are some final items to ensure gym safety. Keep pathways to equipment clear and maintain a safe distance from others during exercise. Instruct clients to stop exercising if they feel faint, dizzy, lightheaded, or nauseous, and tell them to stop or regress an exercise if they can't maintain proper posture and exercise technique. Remember, you must monitor clients at all times during the exercise program and maintain a line of sight with them. And lastly, report any problems, accidents, injuries, or broken equipment in accordance with facility policies and procedures. Welcome to the Legal and Ethical Considerations presentation. A primary legal consideration is what type of professional insurance policy is covering you. If you're employed by a fitness company, verify the type of insurance provided and what the plan covers within your scope of practice. If you're an independent contractor, you need professional liability insurance. Independent contractors should also consult a legal professional to assist with contract development to be sure that you're in compliance with local, state, and federal laws and regulations. In terms of ethical behavior, always be honest with clients and don't guarantee outrageous results. Let clients know that your responsibility is to assess, design, and implement exercise programs that are meant to progress them at an individual rate. You'll also reassess and redesign a program as necessary. Always conduct yourself professionally and avoid offensive language, behavior, and dress. When working with clients, store documents properly. Keep information from assessments, including the PAR-Q or any type of health status questionnaire, in a secure location. Always track your clients' workouts, and don't rely on your memory to know when and how much to progress them. Keeping excellent records is important from a legal standpoint, but it also keeps clients progressing to avoid boredom and burnout with the program. In today's litigious society, it's important to understand how to protect yourself legally and understand ethical behavior required of a health and fitness professional. It's imperative that you remain within your scope of practice and that you don't perform any duties outside of it. You shouldn't diagnose illness or injury, treat injuries, offer psychological counseling, or prescribe special diets for clients. It's essential to refer clients out to the appropriate medical professional whenever they ask for that type of advice or treatment. To protect yourself and ensure safety for your clients, you need to require a provider's release if there's anything that causes you concern with regards to your client's current status. It's your responsibility and right to not provide service to a client who's at risk until you receive documentation from a provider that indicates the parameters within which the client can exercise. Welcome to the Hydration and Micronutrients presentation. Fluid intake and hydration are often overlooked performance factors in fitness and sports training. Research proves the effects of dehydration on endurance, but it also affects strength, power, and high-intensity endurance. Dehydration of more than 2% of body mass can decrease aerobic exercise performance, particularly in warm or hot weather. For clients participating in the training camp program, fluid needs increase due to an increase in heat production and water loss. So follow these guidelines for fluid intake. Drink 14 to 22 ounces of fluid 2 hours before exercise. During exercise, drink 6 to 12 ounces of water or sports drink every 15 to 20 minutes. After exercise, drink 16 to 24 ounces of water or sports drink for every pound of body mass lost during exercise. The goal of drinking during exercise is to keep fluid losses to 2% or less. Dehydration levels higher than 2% can lead to significant performance loss, so instruct your clients to drink fluids that are cool, not cold, to promote absorption and optimize gastric emptying. The focus of rehydration is to fully replace fluid and electrolyte losses. Sport beverages containing sodium help the body stimulate thirst and retain fluids. Clients can monitor their own hydration status through a number of ways. Body mass changes, urine color, and thirst all indicate the need for additional fluids. Measuring body mass before and after exercise and calculating the difference indicates sweat rate. Sweat rate helps determine how much fluid a client needs to replace after exercise. Clients need to know dehydration warning signs before heat illness progresses. Early signs and symptoms include thirst and discomfort. These are generally followed by flushed skin, muscle cramps, and apathy. As water loss continues, you may observe a client experiencing any of the following: dizziness, headache, vomiting, nausea, chills, and/or shortness of breath. Micronutrients are important for energy production, maintenance of bone health, adequate immune function, and the protection of body tissues from oxidative damage. Vitamins and minerals help build and repair muscle tissue following exercise, and exercise increases the need for them. A multivitamin and mineral supplement act as insurance and can help fill in the gaps left by nutrient-deficient diets. Welcome to the components of an integrated exercise program presentation. This presentation discusses essential training components, which include flexibility, cardiorespiratory, core, balance, plyometrics, speed, agility, quickness, and resistance training. For optimal neuromuscular efficiency, clients need proper flexibility in all three planes of motion. This allows clients to move freely to perform athletic activities. A continuum of flexibility training, including self-myofascial release and static and dynamic stretching, is necessary for the client to develop neuromuscular efficiency. You need to integrate all three forms of flexibility training into every training camp program workout. Integrated cardiorespiratory training is a training program method that systematically progresses clients through various stages to achieve the best adaptations. A common error is failing to consider the rate of a client's progression, which is critical in helping them achieve their fitness goals. MMA matches often exhaust all three metabolic pathways. A cardiorespiratory training program must combine aerobic and anaerobic intensity periods to meet the metabolic demands of the sport. A strong core is necessary to fully harness the strength and power of the prime movers. In an efficient state, each structural component of the core distributes weight, absorbs force, and transfers ground reaction forces. For these reasons, core training is a cornerstone in all integrated MMA conditioning and injury prevention programs. Balance is a component of all movement patterns. Balance training is done in a systematic and progressive process that's designed to develop neuromuscular efficiency. Balance training in a proprioceptively enriched environment stimulates neuromuscular adaptations. This leads to improved muscular coordination. So you must understand balance and postural control and their components to effectively train clients and athletes. Speed and power are extremely important to an MMA competitor. The ability of an MMA athlete to perform rapid and powerful kicks and punches is critical to success. Speed and power development through the use of plyometric training is an important part of MMA training program design. Plyometric training overloads the stretch shortening cycle to enhance power output. All MMA athletes need speed, agility, and quickness, also called SAQ, to succeed. The ultimate goal of an SAQ program is to improve a client's ability to apply significant force rapidly in the appropriate direction and to react to an opponent's movement. A carefully designed program that addresses these factors significantly improves overall performance and reduces the risk of injury. Whether the goal is to increase strength, increase muscle mass, develop better athletic performance, or reduce body fat, the use of resistance training is an important component of any MMA training program. This ensures the best athletic performance possible. A planned resistance training program, with progressive and systematic variation, as seen in the training camp program, produces long-term and consistent adaptations and prevents overtraining and injury. Welcome to the Rationale for Movement Prep Programming presentation. MMA strength training and conditioning requires high-intensity cutting and jumping. Clients are particularly affected by injuries due to overtraining, poor neuromuscular control, joint dysfunction, or improper biomechanics. The number of injuries to areas such as the foot, ankle, knees, hips, low back, and shoulders are staggering. Because of this, you must adopt a comprehensive programming strategy to prevent injury, or recondition clients once an injury has occurred. Ankle sprains are the most common sports-related injury. Clients who suffer a lateral ankle sprain risk developing chronic ankle instability. They may also experience hip weakness after an ankle sprain. A comprehensive movement prep program can prevent injuries to the foot and ankle complex. Low back pain affects nearly 80% of all adults. In addition, 6 to 15% of athletes experience low back pain in a given year. Clients who suffer one low back injury are significantly more likely to suffer additional low back injuries, further increasing their time lost for training and competition. Repeated injuries to the back may predispose them to future osteoarthritis and long-term disability. Due to the high incidence of recurrent back injury, prevention of the first injury is the most effective means to promoting health and performance. The incidence of knee injuries is also a concern. An estimated 80,000 to 100,000 anterior cruciate ligament or ACL injuries happen each year in the United States. Approximately 70 to 75% of these are non-contact injuries, meaning the injuries are caused by poor joint mechanics and or neuromuscular control. There's a strong correlation between ACL injuries and future arthritis in the affected knee. Up to 21% of the population reports shoulder pain. Shoulder impingement is the most prevalent diagnosis, accounting for 40 to 65% of reported shoulder pain. Shoulder injuries represent an estimated $39 billion in healthcare costs each year. The persistent nature of shoulder pain may be the result of degenerative changes to a shoulder's articular cartilage, joint capsule, and surrounding ligaments and tendons. This is due to altered shoulder mechanics. Movement prep programming provides optimal neuromuscular efficiency of the shoulder, reducing the incidence of injury. Welcome to the components of Movement Prep Programming presentation. Movement prep programs use a systematic plan to help solve neuromusculoskeletal problems and faulty movement patterns. This plan is known as the corrective exercise continuum. The corrective exercise continuum includes 4 primary phases: inhibit, lengthen, activate, and integrate. The first phase is the inhibit phase. Here, the client uses inhibitory techniques to release tension and/or decrease activity of overactive neuromyofascial tissues in the body. This is done using self-myofascial release techniques such as foam rolling. The gentle pressure breaks up knots within the muscle and helps release unwanted muscular tension. Self-myofascial release is suggested before stretching, because breaking up fascial adhesions may improve the tissue's ability to lengthen through stretching techniques. When a client uses self-myofascial release, they must slowly roll the muscle until a tender spot is found, and then hold pressure on that spot for a minimum of 30 seconds. The second phase is the lengthen phase. Lengthening techniques increase the extensibility, length, and range of motion of neuromyofascial tissues in the body. This is done using static stretching. This is the most common form of stretching in the fitness community. Holding a stretched position for a prolonged period allows for better elongation of the muscle and joint range of motion. The third phase is the activate phase. Activation refers to the stimulation of underactive myofascial tissue. Isolated strengthening includes primarily single joint resistance exercises performed through a full range of motion. The exercises isolate particular muscles to increase force production capabilities and intramuscular coordination. Depending on intensity and volume used, clients can perform isolated strengthening 3 to 5 days per week. Prior to an integrated exercise program, 1 to 2 sets of 10 to 15 repetitions is suitable. The fourth and final phase is the integrate phase. For this phase, a client uses multi-joint integrated dynamic movement techniques. Many injuries occur during eccentric deceleration in the frontal and transverse planes as a result of the inability to control postural alignment. Multi-joint exercises in all planes of motion help increase intermuscular coordination and re-educate the neuromuscular system to maintain proper postural alignment during functional activity. This reestablishes postural control and decreases the risk of injury. Perform the integrate phase 3 to 5 days per week with 1 to 3 sets of 10 to 15 repetitions. Ensure your client does these with a slow and controlled tempo. Remember, movement assessments such as the overhead squat and single leg squat tests help determine what muscles you should address with these corrective exercise strategies. Ideally, clients perform the movement prep programs as a warm-up prior to the training camp program. The movement prep programs, completed on off days, can help the body recover from vigorous activity. This is beneficial to clients since it's a form of active rest. Welcome to the Training Camp Operations presentation. Trainers must design and administer exercise programs that are fun, safe, efficient, and effective, using a multitude of strength training methods and modes. Use proper preparation, organization, and management skills, along with the implementation of exercises, in a structured and progressive manner. When combined, these attributes maximize adherence and minimize the risk of injury. When training a client one-on-one, be alert and attentive at all times to minimize accidents and risk of injury. Come to every exercise session ready to conduct the exercise program as smoothly as possible. Throughout the training camp program, be aware of your client's exercise technique. If a client is unable to maintain proper postural control, regress the exercise accordingly. The training camp program is best implemented in a small group setting, with a recommended group size between 4 to 8 clients and no more than 12. Facility space, equipment, and your ability to effectively organize and manage the group will factor into which size group is best. There are 5 workout blueprints that facilitate constant visual contact. These models are called line, offset, U, circular, and L. First, take a look at the line model. With this model, all stations for the workout are set up in a linear fashion, with ample room between each station. The advantage to the line model is it allows you to see all clients from one stationary position. The disadvantage is it takes up a large amount of room if the stations or equipment are big. In the offset model, all stations for the workout are set up in a linear fashion with each client offset, to allow for ample room between each station. This lets you see all clients from one stationary position and provides more room between clients than the line model. But the offset model also takes up a lot of space. In the U model, clients line up in a U formation. It allows you to see all clients from one stationary position without visual obstruction, and it takes up a relatively small amount of room. However, if you're in the wrong position, you'll have your back to one or more clients. The circular model arranges clients in a circular formation. One of the advantages to this model is that it takes up a relatively small amount of room. However, there is a large portion of unused space in the center of the circle. In the L model, clients line up in an L fashion, as the name implies. This model allows you to view all of the action from one position. The disadvantage is that it requires a lot of free space. When designing a small group program, consider space requirements and exercise equipment choices. If the facility is limited in space, opt for exercises that use small portable equipment such as kettlebells, tubing, dumbbells, and medicine balls. These equipment choices make it easier to manage a group of people and allow clients to seamlessly transition from station to station. Welcome to the Daily Energy Needs and Weight Loss presentation. Total energy expenditure, or TEE, is the amount of energy a client uses in a typical day. TEE is the sum of 3 energy components: resting metabolic rate, thermic effect of food, and energy expended during physical activity. Resting metabolic rate is the amount of energy a client expends at rest, and the minimal amount of energy required to sustain vital bodily functions. The thermic effect of food is the amount of energy a client expends to digest foods, and energy that a client expends during activity is the amount of energy expended above resting metabolic rate and thermic effect of food with any physical activity. Successful weight loss includes small changes, moderate losses, and achievable goals. Depending on body weight, a reasonable rate of weight loss for overweight clients is 1/2 to 2 pounds per week. Evidence shows that clients are able to maintain gradual weight loss better than rapid losses, and clients who want to lose weight can decrease their caloric input, increase their caloric output, or a combination of both. To create a deficit in total energy intake, experts recommend a proportional decrease in all 3 macronutrient categories: carbohydrates, protein, and fat. While there are extensive debates about macronutrient manipulation programs, there's no consensus that one ratio will produce a significantly greater weight loss over another. You may find the acceptable macronutrient distribution ranges, or AMDR, particularly useful. The AMDRs show the range of intake for protein, fat, and carbohydrates, which helps reduce the risk of chronic disease while also providing adequate intake of essential nutrients. If a client consumes an excess or shortage of macronutrients, as the AMDR recommends, there's a risk in the increase of chronic diseases and/or insufficient intakes of essential nutrients. The range can also defend against some of the extreme fad diets that make unrealistic promises. Portion distortion describes the rapidly growing portion size of commercially available food and the resulting distorted consumer expectations. Portions of food at grocery stores, restaurants, and even in homes increased considerably in the past 30 years. Consumers often misunderstand that fat-free and low-carb foods have hidden kilocalories and that their bodies will store any excess nutrients as body fat. It's not just large portions that can derail weight loss success. Some nutritionists believe that people should choose large portions if the food is high in nutrients and low in calories. For example, half of a baked potato and a handful of jelly beans have about the same number of calories, but the potato, with fiber, vitamins, and minerals, is far more nutrient-dense and a better weight loss choice. People feel full because of the amount of food, not calories or the grams of fat, protein, or carbohydrates. Welcome to the supplements presentation. There's solid evidence that a limited number of natural substances, prepared and ingested properly, safely improves training-induced size and performance for many athletes. Proper supplementation for performance often generates truly remarkable benefits, and this can prevent many clients from turning to illegal performance-enhancing drugs. While commercial shakes, powders, and bars are a convenient method for taking in a large amount of kilocalories, they're not required for muscle mass gain. Nutritionists usually prefer fitness enthusiasts and athletes to eat whole foods, which contain not only macronutrients and kilocalories, but micronutrients and phytochemicals. For some, taking in optimal energy and nutrients from whole foods, especially with an exceptionally high level of activity, is often difficult and can cause gastrointestinal distress. For those clients, recommend a meal supplement. For many sports, including MMA, building muscle mass and strength are major goals. Creatine is a legal supplement, common among strength athletes and bodybuilders. Supplementation with it can increase muscle creatine levels and enhance certain types of brief, high-intensity efforts, such as striking flurries and takedowns. The typical dosing plan for creatine includes 2 phases. First, to rapidly increase muscle creatine, begin with 5 to 7 days of supplementation at 20 grams per day. This is followed by a maintenance phase of 2 to 5 grams per day. This phase will sustain maximal muscle creatine levels. Creatine supplementation as part of a strength training program typically causes an initial weight gain of 4 to 5 pounds. Many consider caffeine the most widely used drug in the world. It acts as a stimulant that primarily affects the central nervous system, heart, and skeletal muscles. Most carefully controlled studies demonstrated performance-enhancing effects from caffeine, especially when tested on well-trained athletes performing endurance exercise or high-intensity short-duration exercise lasting about 5 minutes. The most effective performance-enhancing effect comes when the dosage of caffeine is about 3 to 6 milligrams per kilogram of body weight and is ingested about 1 hour before exercise. For a person weighing 70 kilograms or 155 pounds, this dose is equivalent to 210 to 420 milligrams of caffeine. To relate this to coffee, 16 ounces of black coffee ranges from about 200 to 350 milligrams of caffeine. Caffeine doses greater than 6 milligrams per every kilogram of body weight generally show less performance benefit and have more risk of adverse effects. Welcome to the presentation on alternative programming. You can develop a progressive and systematic training camp program for either one client or small group. To provide you with the utmost flexibility, there are several sections that together deliver an integrated training solution. Each of these sections can be removed and used alone to offer a unique program. You can use the warm-up section on its own or in conjunction with a movement prep program prior to any activity. By addressing flexibility needs while increasing heart rate and core temperature, each client will be ready for any exercise. Quickness training provides a variety of unique exercises. When done alone or with other exercises, this form of training addresses speed, agility, and quickness. Also, quickness workouts provide a fun and challenging alternative to enhance footwork, overall speed, or increase caloric expenditure. To provide a total body workout based on stabilization, strength, and power, Performance Prep provides a series of quick strength and conditioning exercises. These exercises target the core and specific body parts while blending in aerobic conditioning. Use these as mini-circuits to meet the time constraints of your client. Workouts in the Ultimate Performance section focus on the entire body. They integrate stabilization, strength, and power of the upper and lower body, while also challenging the cardio system. For clients who aren't conditioned, skip this section until conditioning improves. Daily Training and Conditioning, or DTC, is a series of random workouts for clients who are unable to complete a structured system. These workouts are challenging and dynamic, and you can use them at any time. Because of their uniqueness and randomness, they're able to cover a spectrum of fitness components, which is beneficial for clients who want to improve their overall conditioning. To increase effectiveness, it's important for clients to do additional training on their own. If possible, they need to perform an additional 2 to 3 days of cardio training outside of the program. Also, clients shouldn't take more than 3 days off without an additional cardio training session, total body strength training session, or a training camp program workout. Welcome to the Principles of Adaptation presentation. A human body has the amazing ability to adapt or adjust its functional capacity to meet its needs. And the body's ability to respond and adapt to an exercise stimulus is one of the most important factors of training and conditioning. For most exercise training programs, some form of adaptation is a primary goal. The principle of specificity, or the SAID principle, means the body will specifically adapt to demands placed on it. When applying the SAID principle, remember that there are many types of tissues, and each may respond differently to the same stimulus. You need to consistently manipulate the exercise routine to help your clients meet their goals. Their degree of adaptation directly relates to the mechanical, neuromuscular, and metabolic specificity of the training program. The next several slides describes these principles of specificity in more detail. Mechanical specificity occurs with the combination of weight placement and body movement. For example, to develop muscular endurance of the legs, use light weights and high repetitions. If a client wants to develop maximal strength in their back, use heavy weights and low repetitions. Neuromuscular specificity refers to the speed of muscular contraction and body position. To develop higher levels of stability, have a client perform exercises that are controlled, unstable, and at slower speeds. To develop higher levels of strength, have a client perform exercises in more stable environments with heavier loads. And to develop higher levels of power, have your client perform low-weight, high-velocity contractions in a plyometric manner. Metabolic specificity is the energy demand that the body experiences. To develop cardiovascular and muscular endurance, MMA training requires prolonged periods of exercise with minimal rest in between sets, and endurance training uses aerobic pathways to supply energy for the body. Periodization is a systematic approach to program design, using the principle of specificity. This approach varies body stress to produce adaptation and prevent injury. There are two types of periodization, linear and undulating. Linear periodization varies training at regularly planned periods to elicit different adaptations in the body. Undulating periodization varies training intensities during the course of a week, allowing for multiple adaptations simultaneously. Welcome to the Marketing Strategies presentation. An estimated 8 million people in the United States participate in martial arts, which is generally viewed as a method of self-defense. But competitive martial arts events, such as Taekwondo, Judo, and Jiu-Jitsu, are growing nationally and worldwide. Also, there's a growing interest in mixed martial arts. Participation, media coverage, and monetary prizes for it are rising exponentially. A lot of this is due in part to the development and expansion of professional mixed martial arts. The marketplace for MMA-inspired conditioning is quite large and consists of martial arts studios, exclusive MMA and boxing studios, parks and recreation departments, and fitness facilities. The goal for trainers should be to introduce themselves and market their services to potential clients at all of these facilities. If you're going to have a successful career in the fitness industry, you'll need to take advantage of every marketing opportunity. Marketing refers to identifying what the public needs and deciding if you can meet those needs and make a profit. The first step is to identify your relationship with the local community. One of the strongest marketing tools is promoting your education and certifications to potential clients. Earning the MMA Conditioning Specialist credential and mastering the training camp program means you have more to offer your clients. The MMA Conditioning Specialist credential qualifies you as a specialized health and fitness professional who can lead a client or small group through an MMA-inspired conditioning program. With that program, you can give clients the path to exceptional results. Some action items to help create exposure and develop your niche as an expert in MMA conditioning include taking part in social media, having a professionally made website, business cards, and other marketing collateral. It's also a good idea to set up face-to-face meetings with martial arts instructors and fitness managers. While you need to be ready to promote your business at any time, be proactive and put yourself in front of groups as much as possible. Identify networking opportunities, including martial art academies, parks and recreation, and fitness facilities in your local community. Keep a list of people you talk to and track what you discussed so you can follow up. This helps build rapport, which can lead to a new client or additional referrals. Welcome to the Training Camp Program presentation. Most clients have one or more of the following goals: weight loss, muscle gain, improving athletic performance, and decreasing the risk for injury. The Training Camp program provides you with a unique 3-round training system for one-on-one or group training sessions. The Training Camp program's 3-round system focuses on continuing improvement through increasingly difficult workouts. It systematically improves flexibility, core strength, multiplanar total body strength, speed, quickness, balance, power, and cardio functioning. Each MMA competitor must demonstrate all of these performance traits to be successful. The program also includes movement preparation programs to aid in the prevention of injury. Within each round, there are 8 individual workouts. The 24 workouts are designed to target different muscle groups and energy systems. Each round becomes more challenging and builds upon the previous round. Clients need to perform the program 2 to 3 days per week over an 8 to 12-week period. They'll need to rest at least 24 hours between workouts to facilitate recovery. The training camp program also has many desirable effects, including weight loss, muscle gain, and performance. For weight loss, a client can engage in progressive exercises that use a circuit training model. This helps increase caloric burn, as well as the client's metabolism. For muscular gain, a client can use strength training exercises with limited rest periods. This creates an anabolic hormonal environment that's necessary for optimal muscle growth. And for clients who want to improve performance, the program helps enhance their ability to accelerate, decelerate, and dynamically stabilize their entire body during higher velocity movements, which may include striking, kicking, and grappling. The best approach to minimizing the risk of injury is through a comprehensive injury prevention strategy, or movement prep. First, you need to observe your client for any altered movement patterns. These are the primary causes of musculoskeletal dysfunction. Then, select exercises for your client that correct any faulty patterns. To do this, you'll need a systematic plan, which is known as the corrective exercise continuum. In the continuum, there are 4 primary phases: inhibit, lengthen, activate, and integrate. The inhibit phase uses inhibitory techniques to decrease the activity of overactive neuromyofascial tissues in the body. The lengthen phase uses lengthening techniques to increase the extensibility of neuromyofascial tissues in the body. The activate phase uses activation techniques to re-educate underactive tissues. And the integrate phase uses functional multi-joint movement techniques to retrain the collective synergistic function of all muscles. Welcome to the Subjective Information presentation. Before allowing a new client to participate in any physical activity or assessment, first perform a pre-participation health screening. This health screening includes a medical history questionnaire, a review of chronic disease risk factors, and the presence of any signs or symptoms of disease. Refer to the manual for tables on how to divide up risk based on information collected in the health screening. One of the easiest methods for gathering subjective information is through a Physical Activity Readiness Questionnaire, or PARQ. A PARQ helps you determine at what activity level your client is ready to perform, or if they can't perform certain activities. It can also help identify a client who may need further medical attention. The PARQ pinpoints cardiorespiratory dysfunction, like coronary heart disease, and is a good starting point for gathering information about cardiorespiratory function. While the PARQ is extremely important, asking additional questions regarding your client's medical history is also important, so that you know about past injuries and surgeries. Asking about a client's previous injuries can help illustrate possible dysfunctions they may have. One of the best predictors of future injury is a past injury, because a client could re-injure that area again, or compensate for one that's not fully healed. Injuries can also lead to dysfunction in other parts of the body. Surgery creates trauma for the body similar to that of an injury, and can create possible dysfunction. Some common surgical procedures include foot and ankle surgery, knee surgery, back surgery, shoulder surgery, cesarean section, and appendectomy. In each case, surgery causes pain and inflammation that, if not rehabilitated properly, can alter neurocontrol to the affected muscles and joints. More than 75% of Americans don't engage in 30 minutes per day or more of low to moderate physical activity, increasing the risk of chronic disease significantly for sedentary adults. You are just as likely to work with a client with chronic disease as you are to work with a healthy individual. you could encounter many cardiovascular diseases, such as coronary artery disease, hypertension, and high cholesterol. You may also see chronic pulmonary disorders, such as asthma, and metabolic diseases, such as type 1 or type 2 diabetes. Some clients may need to use one of many types of medications. It's not your responsibility to administer, prescribe, or educate clients on the usage of these drugs. It is important, though, to understand different classes of drugs and the effects they might have on your client's physiology and ability to perform exercise. Refer to your manual for information on common medications and their basic functions and physiological effects. Welcome to the Movement and Cardiorespiratory Assessments presentation. Everyday posture is constantly changing to meet the demands placed on the human body. Because of this, observing movement is the quickest way to get an accurate picture of a client's functional status. The observations you see here show postural distortion and potential muscle imbalances. Movement assessments should relate to basic functions like squatting, pushing, pulling, and balancing. Search for any faulty movement patterns that may lead to injury. The overhead squat test assesses dynamic flexibility, core strength, balance, and overall neuromuscular control. This assessment is a reliable measure of lower extremity movement patterns when you apply standard protocols. These results suggest that movement impairments may help identify possible injury risks in your MMA athletes. Consult your manual for instructions on how to perform the overhead squat test. Like the overhead squat test, the single leg squat movement assessment also assesses dynamic flexibility, core strength, balance, and overall neuromuscular control. It's also a reliable measure of lower extremity movement patterns. Movement impairments that you observe during this test may be the result of alterations in available joint motion, muscle activation, and overall neuromuscular control. Consult your manual on how to perform the single leg squat test and what to look for when your athlete performs it. Cardiorespiratory assessments help you identify safe and effective starting exercise intensities and appropriate types of cardiorespiratory exercise for your MMA athletes. Several tests are valid predictors of maximal oxygen uptake, also called VO2 max. You can use any of these tests, but make sure to factor in considerations such as space, equipment needs, or the type of population you're testing. Take a look at some common submaximal tests you can use. The YMCA 3-minute step test estimates an individual's cardiorespiratory fitness level on the basis of a submaximal bout of stair climbing at a set pace for 3 minutes. Have your client perform 24 steps per minute on a 12-inch step for a total of 3 minutes, which is roughly 96 steps total. Keep your client stepping at the correct pace by using a metronome or stating out loud, up, up, down, down. Within 5 seconds of completing the exercise, measure your client's heart rate for a period of 60 seconds and record the number as the recovery pulse. Consult your manual to determine your client's score. You can use the 1-mile run test to determine your client's cardiorespiratory endurance. This assessment requires a measured distance, such as a mile around a track, a stopwatch, and an optional heart rate monitor. If you don't have access to a track, substitute the YMCA step test. During this assessment, your client runs a mile as fast as possible. At the end of the run, record their time, heart rate, and 1-minute active heart rate recovery. Their time should improve when you reassess. The 12-minute run test measures maximal aerobic capacity. This assessment requires a track with clearly marked distances and a stopwatch. If you don't have access to a track, substitute the YMCA step test. Following a comprehensive warm-up, have your client run as far as possible within 12 minutes. Record the distance they travel, then calculate the distance recorded into meters. Compare the results when you reassess. Consult your manual for data and scores. Welcome to the Weight Gain and Performance Enhancement presentation. As excess body weight results from an energy equation imbalance, so does being underweight. A client who wants to gain weight can accomplish that by adding energy into their diet while increasing strength training to promote muscle growth. How quickly weight gain happens for your client depends on several factors. These include age, gender, training experience, genetic makeup, degree of positive energy balance, diet composition, timing of meals, the number of rest and recovery days per week, and the type of exercise training program they choose. Strategies for ensuring adequate energy for weight gain include adding energy-dense foods, eating regular meals and snacks, increasing portion sizes during meals, and using beverages such as juice or smoothies to add calories. Finally, resistance training increases muscle size and strength. Performance nutrition is a combination of strategies to enhance physical and athletic performance through specific food and nutrient choices. One of the most important benefits of performance nutrition strategies is injury prevention. Fatigue is a significant variable for athletes who are training and competing. As an athlete fatigues, the risk of injury increases. So both fatigue and injury can decrease with proper nutrition. Fuel burned during exercise depends on the intensity and duration of an activity. As intensity increases, so does the contribution of carbohydrates as an energy source for optimal performance. MMA athletes typically train and compete at 65% or more of maximum oxygen uptake, or VO2 max. At this level, carbohydrates are the predominant fuel. With such limited stores of carbohydrates, the greater the pre-exercise carbohydrate content, the longer an athlete can exercise. A common misconception is that an enormous amount of protein is necessary to produce gains in muscle mass. While protein synthesis does occur after training, it's actually carbohydrates that fuel the anaerobic type of training that produces strength and size gains. Most athletes can meet these protein requirements with adequate kilocalories and healthy meals and snacks. Eating whole foods following exercise doesn't deliver nutrients fast enough to maximize results because of the length of time it takes to digest and absorb nutrients. Immediately following exercise, muscle cell nutrient uptake is at its highest point of the day, and therefore this window of opportunity requires a well-designed and fast-acting meal replacement formula. Research shows that consuming pre- and post-training fast-acting replacement formulas can stimulate muscle protein synthesis and reduce muscle damage to a far greater extent than normal meals. While the post-training metabolic window is active for as much as 60 to 90 minutes, its maximum activity, greatest nutrient uptake, and protein synthesis takes place immediately following exercise. Welcome to the presentation on warm-up components of the training camp program. The training camp program is comprised of 24 workouts designed to target different muscle groups and the aerobic or anaerobic energy systems. Each workout is structured with 8 distinct sections. You need to understand the types of exercises and how each are performed. To maximize results and minimize the risk of injury, the first 3 sections are dedicated to warm-up. Section 1 is the pre-workout stretch. This section includes flexibility training, such as static stretching like you see here. Static stretching is a key component for all training programs. It's used for a variety of reasons, including correcting muscle imbalances, increasing joint range of motion, relieving joint stress, improving the extensibility of muscles and tendons, maintaining the normal functional length of muscles, and improving neuromuscular efficiency. Static stretching passively takes a muscle to the point of tension, holding the stretch for a minimum of 30 seconds. Holding the muscle in a stretched position allows it to relax and provides for better elongation. Joint range of motion is integral for mixed martial artists to perform techniques with precision. Use static stretching to decrease the muscle spindle activity before and after workouts. The cardio portion of a warm-up period typically lasts 5 minutes and consists of whole-body dynamic movements. The purpose of the warm-up is to increase heart and respiration rates, tissue temperature, neural recruitment of muscle, and psychologically prepare your client for higher training intensities. NASM recommends a low to moderate intensity cardio warm-up. Depending on your client's goals, objectives, or limitations, modify the warm-up period by adjusting time or activities. Recommended cardio warm-up activities include jumping rope, walking or jogging on a treadmill, or exercising on other types of cardio machines. The final section of the warm-up program includes dynamic stretching. Dynamic stretching uses the force production of a muscle and the body's momentum to take a joint through the full available range of motion. During the training camp program, clients will typically perform 5 prescripted dynamic stretches. Combining static stretching to increase tissue extensibility with dynamic stretching to increase motor neuron excitability can improve pre-activity neuromuscular coordination. Finally, the dynamic warm-up period prepares the body for activity. It's important to monitor the intensity so clients don't fatigue before the workout actually begins. Moderate intensity and duration during an activity ensures a proper warm-up. NASM recommends clients show good levels of tissue extensibility, core stability, and balance capabilities before starting an aggressive dynamic stretching program. Welcome to the components of the Training Camp Program presentation. The Training Camp Program consists of 4 key components: human performance testing, program design, coaching and implementation, and nutrition and supplementation. The first component of the program is implementing a systematic human performance testing process or a fitness assessment. This is a problem-solving method that helps you evaluate a client's exercise needs and current fitness status. It also allows you to make adjustments as the client's fitness improves. The assessments in this program integrate dynamic posture, body composition, and cardiorespiratory fitness tests. The second component is program design. Its structure consists of 4 parts: movement prep programs, Round 1 training, Round 2 training, and Round 3 training. Each round includes 8 workouts, for a total of 24 workouts in the program. Now take a look at movement prep. Instruct your clients to perform the movement prep programs before each training camp workout. These programs are also appropriate for off days as recovery work. Their designs help to mentally and physically prepare clients for intense training. The movement prep programs systematically help to identify neuromusculoskeletal dysfunction. This allows you to integrate corrective exercise strategies to reduce injury and maximize recovery. After movement prep, transition your client to Round 1. Here the goals are to increase aerobic capacity, muscular endurance, and stability, which is similar to the stabilization level of the OPT model. Inefficient stabilization negatively affects the way muscles produce force, can increase stress at joints, and may cause injury. Round 1 effectively prepares a client's body for the advanced training in Rounds 2 and 3. Round 2 maintains stabilization endurance while also increasing strength, muscle size, and work capacity. Also, clients are able to increase lifting intensity and volume, while decreasing rest periods between exercises. Round 2 is similar to the strength level of the OPT model and prepares clients for Round 3 training. Round 3 is for clients who completed Rounds 1 and 2. It focuses on developing power, quickness, and metabolic conditioning. Round 3 is similar to the power level of the OPT model because it combines high-intensity and multi-joint strength training exercises with intense cardiovascular circuits. All 3 rounds of training use a similar format. During each session, a client needs to complete the following. First, movement prep or pre-workout stretch, which is improving range of motion and neuromuscular activation. Second, cardio warm-up, which is to increase heart and breathing rates. Third, a dynamic warm-up, which is the final step to help prepare the client's body for intense training. Fourth, quickness training, which is to improve reaction and change of direction skills. Fifth, performance prep, which uses core, balance, plyometric, and cardiovascular exercise to develop total body performance. And last, ultimate performance, which is a series of strength and conditioning exercises that simulate the intensity of an MMA match. Here are some points to help you remember the workout portion of the training camp program. First, clients need to perform all exercises in a circuit fashion to challenge and improve their aerobic and anaerobic fitness. Like any training system, it's important to understand and master the elements that make it unique. Also, you can manipulate the exercises that you learn to meet the needs of your clients. The third major component of the training camp program is coaching and program implementation. To be successful at implementing, you must use your coaching skills to keep each workout safe, organized, and effective. It's important to perform, communicate, and demonstrate each element of the program to provide the best possible experience for your clients. The fourth and final component of the training camp program is nutrition. As fad diets continue to grow, you need to be knowledgeable about nutritional facts. The training camp program addresses key nutrition and supplementation strategies for weight loss, gaining muscle, and improved athletic performance. This information will help you provide accurate nutritional advice to your clients. Welcome to the Training Camp Conditioning Rounds presentation. The first round of training focuses on the adaptation of stabilization and achieving an aerobic baseline level of fitness. It's also necessary to cycle back through this phase of training following periods of intense MMA conditioning. This helps to maintain a high degree of core and joint stability. Round 1 follows many of the same training strategies that you see in the stabilization level of NASM's OPT model. The goals of Round 1 training include the following: improving muscular endurance and aerobic capacity, enhancing joint stability, increasing flexibility, enhancing control of posture, and improving neuromuscular efficiency. Round 2 focuses on the adaptations of strength endurance, muscular hypertrophy, and continuing to improve cardio fitness. This period of training is a necessary progression that helps develop muscle size and strength, as well as improve overall performance. Round 2 follows many of the same training strategies that you see in the strength level of NASM's OPT model. The goals of Round 2 training include improving muscular endurance and increasing prime mover strength, improving overall work capacity, increasing lean body mass, increasing the load-bearing capabilities of muscles, tendons, ligaments, and joints, increasing the volume of training with more reps, sets, and intensity, and increasing metabolic demand by taxing the anaerobic energy systems. Your client should only enter Round 3 after successfully completing Rounds 1 and 2. This level of training emphasizes the development of power, quickness, and metabolic or anaerobic conditioning, and simulates the intensity of being in an MMA match. Round 3 follows many of the same strategies that you see in the power level of NASM's OPT model. The goals of Round 3 training include enhancing prime mover strength, increasing rate of force production or power, enhancing reaction time or quickness, and improving metabolic conditioning. All workouts have 8 distinct sections. The first 4 sections are pre-workout stretch, which increases a client's flexibility, cardio warm-up, which elevates the client's heart and respiration rates, dynamic warm-up, which continues to warm up and enhance your client's joint range of motion, and quickness training, which enhances your client's ability to react with maximum rate of force production. The 4 remaining sections of each workout are performance prep instruction, which prepare clients for the performance prep section and gives them a brief chance to rest. Performance prep, which enhances lean muscle mass and cardiorespiratory efficiency. Ultimate performance instruction, which prepares clients for the ultimate performance section and one last chance to rest. And finally, the ultimate performance, which simulates a professional fighter's training routine by using a multitude of functional strength and cardio methods. A cool down is an important part of any well-designed exercise program. Once clients complete a workout, they should spend 5 to 10 minutes cooling down, using low-intensity cardiorespiratory training. Also, clients need to do 3 to 5 static stretches to reset muscles. This slowly brings the body back to some sense of normalcy and prevents blood from pooling in the lower extremities. Welcome to the Integrated Training Principles presentation. This presentation discusses the importance of the stretch shortening cycle and training with proper form through multiple planes of motion. An important factor in athletic performance is explosive force. This happens by using the stretch shortening cycle. This occurs when a rapid eccentric muscle action creates a stretch reflex. For example, think of stretching a rubber band just before letting it go. This same stretch occurs in your client's muscles. When the central nervous system senses this action, it starts to store potential energy. Then motor neurons release this energy, which produces a concentric contraction that's more forceful than what resting muscles generate. So the shorter the amount of time between the eccentric muscle action and the concentric contraction, the greater the force production. Explosive muscular contractions are common in MMA competition, such as performing a jump kick or attempting a takedown. Specific exercises, such as plyometrics, can increase power output and explosiveness by training muscles to do more work in a shorter amount of time. When eccentric strength, neuromuscular efficiency, and stabilization strength are optimized, your clients will realize greater concentric force production. For this reason, the training camp program integrates plyometric exercises that maximize the stretch shortening cycle. The central nervous system optimizes the selection of muscle synergies to perform complex movement patterns in all 3 planes of motion at the same time. Isolated training does little to improve overall athletic performance, whereas using an integrated, multiplanar approach to training will develop high levels of dynamic flexibility, core strength, neuromuscular control, speed, agility, and strength in your client. These are all necessary skills for an MMA athlete. Every MMA event occurs in all 3 planes of motion: sagittal, frontal, and transverse. So training only in the sagittal plane won't effectively prepare your client's frontal and transverse dominant muscles. Because many athletic injuries happen in the frontal and transverse planes, you must develop a multiplanar training program to effectively prepare your clients for their athletic activities and help prevent injury. Maintaining optimum postural alignment is a cornerstone to any MMA training program. If one segment of the body is out of alignment, other segments must compensate, which decreases neuromuscular efficiency and increases the chance of injury. Training with proper posture ensures optimum results and decreases the risk of tissue overload. Muscles function best when they're in ideal length. This is called optimum length-tension relationship. Muscle overactivity, adaptive muscle shortening, or both, can cause altered reciprocal inhibition and synergistic dominance. Altered reciprocal inhibition happens when a tight agonist decreases the neural drive to its functional antagonist or opposing muscle group. For example, due to the high volume of kicking required for MMA, the hip flexors can become tight. This can decrease neural drive to the gluteus maximus and decreases its ability to produce force. Synergistic dominance is a neuromuscular phenomenon that occurs when synergists take over function for a weak prime mover. For example, a weak gluteus maximus increases force output of synergist muscles such as the hamstring complex. The result of synergistic dominance is faulty movement patterns, joint dysfunction, and eventual injury such as hamstring strains. MMA training programs need to ensure the development of optimum muscle balance. Development of optimum muscle balance helps prevent injury and achieve maximal power output. An integrated functional training program focuses on multi-directional training. It also activates the entire muscle contraction spectrum, eccentric, isometric, and concentric muscle contractions. Use multiple modalities, such as dumbbells, machines, or medicine balls. The program also incorporates essential training strategies like flexibility, core, balance, plyometrics, speed, agility, quickness, resistance training, and sport-specific metabolic conditioning. Welcome to the presentation on the training camp components. The training camp program consists of 24 workouts designed to target different muscle groups and energy systems. Each workout is structured with 8 distinct sections. The first 3 are dedicated to the warm-up, and the last 5 focus on MMA conditioning and performance, including quickness training, performance prep instruction, performance prep, ultimate performance instruction, and ultimate performance. Quickness is the ability to react and change body position with maximal force production in all planes of motion and from all body positions. A quick MMA athlete can assess a situation and apply the necessary actions at a very high speed. The increase in neuromuscular and physiological demands help with weight loss, coordination, and movement proficiency. Quickness training requires a greater integration of the body's biological systems, and its unique challenges facilitate constant responses and adaptation. Because of the elevated intensity with quickness training protocols, NASM recommends extensive client evaluations for exercise experience, movement quality, health history, and injury profile before starting quickness training exercises. During the performance prep instruction, you're preparing clients for the performance prep section. This instructional period lasts 2 to 5 minutes, depending on the workout. It also gives clients a chance to rest. Inadequate rest intervals can decrease performance and can lead to altered movement patterns and even injury. After allowing your client time to rest, you can move on to performance prep. The workout is based on stabilization, strength, and power, with core, balance, and strength training exercises. These exercises target specific body parts. The goal is to improve postural control, neuromuscular coordination, and strengthen the muscles that stabilize, align, and move the hip and trunk of the body. A weak core and poor balance related to inefficient movement may lead to patterns of injury. Properly integrating performance prep training helps gain neuromuscular control, stability, muscular endurance, strength, and power. Your client should do the exercises for performance prep in a circuit fashion. Completing the section can take 8 to 10 minutes. During the Ultimate Performance instruction, prepare clients for the Ultimate Performance section. At this stage, clients may experience fatigue, so communicate clearly and concisely. This instructional period lasts roughly 3 minutes and gives clients one of their last chances to rest and hydrate. The Ultimate Performance section simulates an MMA athlete's training routine using strength and cardiovascular training methods in a highly charged, non-stop environment. That environment simulates the energy requirements of an MMA competition. The training targets all energy systems and improves your client's cardiorespiratory efficiency through high-paced circuit routines. The Ultimate Performance section uses circuit training to produce comparable results to traditional aerobic training in a shorter time frame. Several studies compared the effects of circuit weight training with traditional endurance exercise. Research shows that circuit training results in higher post-exercise metabolic rates, as well as strength levels. Welcome to the Objective Information presentation. Objective information provides you with quantifiable data. With data measured in weeks, months, or years later, you can use this information to compare where your client begins and look for improvement or deterioration in performance. Basic categories of objective information include physiological assessments, movement assessments, cardiorespiratory assessments, and performance assessments. Physiological assessments provide information about your client's overall health status. Regular assessments provide valuable information when designing your client's conditioning program, such as resting heart rate, estimated max heart rate, body fat, circumference, and body mass. You can take resting heart rate at the radial artery, which is at the base of the thumb like you see here, and at the carotid artery, which is on the side of the neck. Teach your clients to take their resting heart rate as soon as they rise each morning, and have them record the numbers and average the score over 3 days. Your clients' resting heart rates will vary. For men, the average pulse is 70 beats per minute, and for women, it's 75 beats per minute. As a person becomes more fit, their resting heart rate decreases. You can use maximal heart rate to establish training intensity during cardio training. One of the most common formulas is 220 minus the client's age. This formula is not intended as the basis for a cardiorespiratory fitness program, so you should never use this or any other formula as an absolute. However, this equation is very simple to use, and you can easily implement it as a general starting point for measuring cardiorespiratory training intensity. Heart rate reserve, also called the Carvonen method, is a method of establishing training intensities based on the difference between your client's estimated heart rate max and their resting heart rate. Heart rate and oxygen uptake are closely related during exercise. Using a target heart rate based on a given oxygen consumption is a widely accepted method of establishing exercise intensity. Target heart rate equals heart rate max minus resting heart rate times desired intensity plus resting heart rate. Taking body composition measurements at regular intervals is good for data comparison and can motivate your clients. Lean body mass is important for MMA athletes and fitness enthusiasts. So knowing a client's body fat percentage can determine their lean body mass. Some commonly recommended ranges for body fat percentage are 10 to 20% for men and 20 to 30% for women. There are a variety of ways to measure body fat: skin fold measurements, bioelectrical impedance, and underwater weighing. Because most health and fitness professionals don't have an exercise physiology laboratory at their disposal to perform underwater weighing, and bioelectrical impedance requires little instruction, this presentation focuses exclusively on skin fold measurements. The National Academy of Sports Medicine recommends using the Dernan-Wormersley formula when measuring skin folds. You can take skin fold measurements at 4 sites: biceps, triceps, subscapular, and iliac crest. Always take skin fold measurements on the right side of the body, like you see here. Add the totals and consult the table in your manual to determine your client's body fat percentage. Another source of feedback for MMA athletes wanting to change their body composition is circumference measurements. When taking circumference measurements, it's important to be consistent. Take all measurements with the same tape and keep the tape taut and horizontal to the area you are measuring. You can take circumference measurements at the neck, chest, waist, hips, thighs, calves, and biceps. Refer to your manual for instructions on how to perform each measurement. Body mass index, or BMI, is based on the concept that a person's weight is proportional to their height. BMI does not calculate fat. It's just a simple calculation that helps determine an appropriate weight-to-height ratio. You can calculate BMI either by dividing the weight in kilograms by the square of the height in meters, or by dividing body weight in pounds by the square of height in inches and multiplying by 703. Research shows that people with a BMI above 25 or below 18.5 have an increased risk of developing disease and suffering from premature death. Welcome to the Performance Assessments presentation. Use performance assessments to assess your MMA athlete's overall athletic performance. These assessments should measure muscular endurance, stability, strength, power, and anaerobic conditioning. With repeated testing, you can track fitness and athletic performance changes, both positive and negative, in response to training cycles and injury. Using data from these tests, you can modify your exercise program to fit the needs of your athletes. The push-up test measures muscular endurance of the upper body, primarily the pushing muscles. To perform the test, tell your client to begin in a push-up position with the body in a straight line like you see here. She should perform the push-up exercise for 60 seconds or until exhaustion. She can also perform push-ups from a kneeling position if needed. Your client should be able to perform more push-ups when you reassess. The pull-up test also measures muscular endurance of the upper body, but this time it's primarily in the pulling muscles. To perform this test, have your client grasp the bar with the palms forward grip. He should perform the pull-up exercise until exhaustion. Record the total number of repetitions he performs without compensating with body swings, kicking, or creating momentum. Your client should be able to perform more pull-ups when you reassess. The Davies test measures upper extremity agility and stabilization. This assessment may not be suitable for clients who lack shoulder stability. To perform the Davies test, place 2 pieces of tape on the floor, 36 inches apart. Have your client assume a push-up position with one hand on each piece of tape, like you see here. Instruct your client to quickly move his right hand to touch the left hand. He should perform alternating touching on each side for 15 seconds. Record the number of lines touched by both hands. Repeat for 3 trials. Reassess in the future to measure the improvement in the number of touches. The Shark Skill Test assesses lower extremity agility and neuromuscular control. It's a progression from the single leg squat test and may not be suitable for all individuals. To perform the Shark Skill Test, position your client in the center box of a grid with his hands on his hips and standing on one leg like you see here. Instruct him to hop to each box in a designated pattern, always returning to the center box. Be consistent with the patterns. Have your client perform one practice run through the boxes with each foot. When ready, have your client perform the test twice with each foot and record the times. Consult your manual on how to score the test and how to add time for foot faults and other errors. The bench press strength test assesses absolute pressing strength of the upper body. You can also use this test to determine training intensities for bench press exercises. This advanced assessment may not be appropriate for many clients and is only necessary for MMA athletes or clients with specific strength and performance goals. To perform a bench press assessment, position your client supine on a bench like you see here. His feet should point straight ahead with the low back in a neutral position. Warm up with a light resistance that he can easily perform for 8 to 10 repetitions. After resting for 1 minute, add 10 to 20 pounds or 5 to 10% of the initial load and have him perform 3 to 5 repetitions. Rest for 2 minutes. Repeat steps 4 and 5 until your client achieves failure between 2 and 10 repetitions. Consult your manual to calculate the 1 repetition maximum. The squat strength test estimates absolute lower body strength. You can also use this test to determine training intensities for the squat exercise. This test is only appropriate for MMA athletes and clients with advanced strength and performance goals. For this test, position your client's feet shoulder-width apart, pointing straight ahead with the knees in line with the toes, just like you see here. His low back should be in a neutral position. Warm up with a light resistance that he can easily perform for 8 to 10 repetitions. Rest for 1 minute. Add 30 to 40 pounds or 10 to 20% of initial load and perform 3 to 5 repetitions. Rest for 2 minutes, repeat steps 4 and 5 until your client achieves failure between 2 and 10 repetitions, or 3 to 5 repetitions for greater accuracy. Consult your manual to calculate the 1 repetition max. The vertical jump test measures total body bilateral power. To perform this test, position your client perpendicular to a wall 6 to 8 inches away. Measure his standing reach with one arm fully extended upward. From a standing position, direct him to jump explosively upward like you see here. He can perform a counter movement or a squat prior to the jump if his feet maintain contact with the floor. Instruct him to touch the wall at the highest point of the counter movement jump. Measure the height difference between the standing reach and jumping height. Perform the test 3 times and measure the highest jump from the floor to the point of contact with the wall. The double leg horizontal jump test measures total body bilateral power in a more dynamic fashion by jumping for distance rather than height. To perform this test, extend a tape measure along a non-skid surface and make a start line with athletic tape. Instruct your client to jump forward as far as possible like you see here. Record the distance from the edge of the starting line to her heel. If she falls backward, record the distance from the body part nearest the starting line. The 300-yard shuttle test measures total anaerobic endurance. To perform this test, place marker cones and lines 25 yards apart like this to indicate the sprint distance. Your client starts with a foot on one line. Using a timer, instruct your client to run to the opposite 25-yard line, touch it with her foot, turn and run back to the starting line. Your client performs 6 repetitions without stopping, covering 300 yards total. After a 5-minute rest, repeat the test.